Hi everyone, this is your pharmacist, and today we'll talk about the most widely used drug that is metronidazole. It belongs to a class that is nitronidazole. This medicine is sold under the brand name of Flagyl and Metrozine. You can see on the right side that the pack is the brand name is Flagyl, the generic is metronidazole, and the strength is 400 mg, and the right bottom, the company name is Sanofi. So let's see how metronidazole works. It belongs to a group of medicine that is antibiotics. It works by killing bacteria and parasites that cause infection in your body. It can be used to treat infection of the blood, brain, lungs, bones, genital tract, pelvic area, intestine, and stomach. It can also be used to treat gum ulcers and other dental infections, and it is used to treat infected leg ulcers and prevent infections after surgery. It is basically used to treat skin infection, rosacea, pelvic inflammatory disease, skin ulcers, bed sores, and wounds. As this metronidazole is a prescription medicine and your doctor will prescribe it for many other infections. So before you take this medicine, we have warning and precautions. Like if you have a liver problem, if you are having kidney dialysis, and you have a disease of the nervous system, then these things you must need to tell your doctor. Why you should not take this metronidazole if you are allergic or hypersensitive to metronidazole or nitroamidazole, for example, tinidazole or any other ingredient of this medicine. Well, how can you know that you are allergic to this medicine if you have ever taken before this? Like you get a rash, swallowing, or swelling of the lip, face, throat, or tongue. In particular, your doctor knows that if you are taking metronidazole, then these medications must not be taken along. For example, medicines that are used to thin the blood, for example, warfarin, the lithium that is used for mental illness, phenobarbital and phenytoin for epilepsy, 5-fluorouracil for cancer, busulfan for leukemia, that is a blood cancer, cyclosporin to reduce or to suppress your immune system to prevent the rejection of organ after transplant, and disulfiram for alcoholism. Medicines that may also cause heart rhythm disturbances, for example, antiarrhythmic for heart rhythm disorders, and certain antibiotics that are primarily used to manage psychosis. It is very important that you finish a full course of treatment that is 3 days or longer, 7 days. The length of the course will depend on the need and the illness that is going to be treated. How you take the metronidazole, 200 mg, 400 mg, like you swallow the tablet whole with a drink of water, and you will not crush or chew the tablet, and you will take this tablet during or after the meal. Now, what are the side effects of this taking metronidazole? You will have your stomach upset, diarrhea, vomiting, abdominal pain, urge for vomiting. So there is a thing that you take it with the meal or after the meal to avoid stomach upset. What is the dose of metronidazole for adult and children? The dose of metronidazole will depend on the need as discussed before, but the recommended dose to treat bacterial infection in adult is the initial dose is 800 mg, which is 2 tablets of 400 mg. And after every 8 hours, you need to take another dose. The peak concentration of metronidazole is 1 hour to 2 hours, but it will almost take 48 hours or 3 days to fully eradicate the infection. But in children, your doctor will see that how much your child should take depending on the weight of the child. But the repetition of the dose is the same, which is 8 hours. This medicine is available as tablet, capsules, extended release tablets, and oral solution, and in an injectable form. The tablets are available over the counter, capsules are also available over the counter. The extended release tablets an oral solution, but an injectable form, it is mostly used in hospitalized setting. Tablets are 200 or 400 mg, and generic metronidazole is also available. With what are the again precautions, like you should stop using or having alcohol and products that contain propylene glycol, which is a food additive, and it should be avoided. And it should be avoided mm, after you have stopped taking the therapy and after 3 dose has been gone. Like you should stop taking it. And for a layman or for someone that layman person, this medicine, this metronidazole is has no activity against viruses. If you have flu and cold symptoms, then this metronidazole will not have any effect on the infection or the symptom that you are having. The contraindications, the side effects is like many will not have it, but some will have it. So you need to take a avoid. If you are having alcohol or drinking alcohol, then you should stop taking it, because when you are taking alcohol, then it will worsen the side effects. For example, you have vomiting, you have palpitations, you have hot flushes, you have severe kind of headache. So these are the precautions. And metronidazole is widely used. It can be used for any sort of infection, and your doctor knows for what kind of infection he is prescribing. So be in contact with your doctor. If you have learned anything, if you have revised anything, then I am requesting you to please subscribe my channel and share with your pharmacy students or the people who have just started their studies.